Chapter 13, Treatment of Disorders. This is Section 5, Treatment. Psychotherapy is the treatment of psychological disorders through psychological means, such as talking about problems and exploring new ways of thinking and acting. Some basic features of treatment. The basic features of treatment for disorders include a client or patient, a therapist or helper, a special relationship between the two, a theory about the causes of the client's problems, and a set of treatment procedures to address the client's problems. Inpatients receive treatment while staying in a hospital or other residential institution. They have impairments severe enough to create a threat to their own well-being or that of others. Their treatment almost always includes psychoactive drugs. Outpatients receive treatment while living in the community. There are many providers of psychological treatment. Psychiatrists are medical doctors specially trained to treat mental disorders. They are authorized to prescribe drugs. Psychologists who do psychotherapy have usually completed a doctoral program in clinical or counseling psychology, sometimes with additional specialized training. Except for New Mexico and Louisiana, psychologists in the United States may not prescribe drugs. However, many other states are currently considering granting prescription privileges to specially trained psychologists. Clinical social workers, marriage and family therapists, and licensed professional counselors usually hold a master's degree in their field and provide therapy in hospitals, clinics, or private practice. Psychiatric nurses, substance abuse counselors, pastoral counselors, and paraprofessional providers provide therapy, usually as part of a treatment team. The basic goal in psychotherapy is to help troubled people change their thinking, feelings, and behavior to relieve discomfort, and to promote happiness and better functioning in their life roles. The majority of mental health professionals see themselves as eclectic therapists, borrowing effective methods from many types of therapy. Psychodynamic psychotherapy. Psychoanalysis, Sigmund Freud's treatment method, was aimed at understanding unconscious conflicts and how they affect clients. Almost all forms of psychotherapy reflect some of Freud's ideas, including his one-to-one method of treating people, his systematic search for relationships between an individual's life history and current problems, his emphasis on thoughts, emotions, and motivations in treatment, and his focus on the client-therapist relationship. Classical psychoanalysis. Originally, Freud had hypnotized patients recall events that might have caused their problems. Later, he merely had patients lie on a couch, relax, and report whatever came to mind, or free association. Many patients taking Freud's talking cure reported memories of child sexual abuse. Freud decided that these reflected childhood fantasies and unconscious conflicts, a judgment that has since been criticized. Classic psychoanalysis used free association, dream analysis, and analysis of the way the client reacts to the therapist, or transference, to help a client gain insight into problems. Clients first recognize unconscious thoughts and emotions, then work through the many ways in which those unconscious elements affect their everyday life. This treatment may require as many as 3 to 5 sessions per week for several years. The contemporary variations on psychoanalysis. Classical psychoanalysis is not as prevalent as it was. Currently, there is more focus on social relationships in clients' problems and how the ego can be used to solve them. In short-term psychodynamic psychotherapy, the aim is to provide benefits in far less time than is required in classical psychoanalysis. In object relations therapy, the powerful need for human contact and support is important. Object relations therapists work to develop a nurturing relationship with their clients, providing a second chance for those clients to receive the support that might have been absent in infancy, and to counteract some of the consequences of maladaptive early attachment patterns. Interpersonal therapy focuses on helping clients overcome problems with relationships that occur after childhood. Humanistic psychotherapy. Humanistic psychologists, sometimes called phenomenologists, view people as capable of consciously controlling their own actions and taking responsibility for their decisions. Human behavior is innately driven toward growth and is guided by the way people perceive their world. When there are distorted perceptions or lack of awareness about feelings, growth is blocked. Humanistic therapy operates on 4 assumptions. Treatment is seen as a human encounter between equals, not a cure from an expert. Clients will improve on their own given the right conditions. Ideal conditions in therapy can best be established through a therapeutic relationship in which clients are made to feel accepted and supported as human beings. It is the client's experience of this relationship that brings beneficial changes. Clients must remain responsible for choosing how they will think and behave. Client-centered therapy. Carl Rogers' client-centered therapy or person-centered therapy relies on the creation of a relationship that reflects 3 intertwined therapist attitudes. Unconditional positive regard. Therapists show unconditional positive regard, always treating the client as a valued person, no matter what. The therapist listens without interrupting or giving advice, accepting and trusting the client's insights without judgment. Empathy. Therapists try to see the world as the client sees it. They try to develop empathy, an emotional understanding of what the client might be thinking and feeling. Empathy is shown by active listening and reflection, paraphrasing back to the client what he or she seems to be saying and feeling. And finally, congruence. Congruence, or genuineness, refers to consistency between what the therapist feels and the way she or he acts towards the client. The therapist must not just say the client is accepted and valued, the therapist must feel it. And Gestalt therapy. Frederick S. Fritz Perls and his wife Laura were founders of Gestalt therapy. They believe that people create their own versions of reality and that people's natural psychological growth continues only as long as they perceive, remain aware of, and act on their true feelings. Gestalt therapists use more direct and dramatic methods. They may prod clients to become aware of feelings they have disowned and to discard ideas and values that are not really their own. They may point out inconsistencies between what clients say and how they behave. Clients may engage in imaginary dialogues with people and even inanimate objects or parts of their own personality to get in touch with themselves. And that is section 5, treatment.